This week, we're talking about Medicaid. Wait, no, don't click away. I know you know what Medicaid is, but this week, what we're talking about is the Medicaid rebase. You've heard of that, right? Let's get into it. You might not be on Medicaid yourself, but Medicaid matters. Medicaid in North Carolina is health insurance for 1 in every 4 North Carolinians. That's around 3 million people. And it includes children, people with disabilities, seniors in nursing homes, and yes, low income working folks. Since North Carolina expanded Medicaid eligibility last year, even more folks qualify, like the restaurant worker without job benefits or the small business owner who can't afford private insurance. Medicaid is about more than just the people who are directly enrolled. It's the financial backbone of our healthcare system. The American healthcare industry is motivated by profit. And without Medicaid, there aren't just individuals, but entire communities that aren't profitable enough to be able to serve. Rural hospitals rely on well-funded Medicaid programs to keep their doors open. When Medicaid rates get cut, hospitals lose money. When hospitals lose money, they make it up somewhere else. That means higher costs for people with private insurance and cost-cutting measures that can reduce staffing. Medicaid dollars keep doctors in our towns, keep nursing homes open, and keep mental health services available. When Republicans shortchange Medicaid, they're not just hurting Medicaid patients, they're destabilizing care for all of us. So, what's going on? Every year, the state has to do something called a rebase of Medicaid. That's when they update the budget to reflect the actual cost of caring for people. Because costs change, populations change, and the needs change. It's not a surprise, and everyone knows it's coming, and that we have to fund the rebase to keep our standard of care. But this year, Republicans in the General Assembly have underfunded that rebase by hundreds of millions of dollars. Over the summer, North Carolina Republicans passed a stopgap bill, a mini budget, because they couldn't get a real one done, and it left a $319 million shortfall against an $819 million rebase. Plainly, a whole hell of a lot of money is missing. North Carolina's Secretary of Health and Human Services has been sounding the alarms. They've made it clear that spending plan right now is unsustainable and it's going to harm the people of North Carolina. They've said over time, the combination of underfunding, the loss of initiatives, and administrative budget shortfalls risk a fundamental erosion of the North Carolina Medicaid program. That is a crisis of the GOP's own design. They knew that rebasing Medicaid was coming and what it was going to cost them. But here they are, choosing austerity over healthcare. And let's be real, wealthy folks like a lot of these lawmakers and their friends will always be able to find healthcare. It's the working class families, our neighbors with disabled children, seniors on fixed incomes, and rural communities who will get left behind.